Abnormal primary motility of the biliary tract is called biliary dyskinesia. Type: gallbladder dyskinesia, sphincter of OD dyskinesia. Biliary dyskinesia হলো gallbladder dyskinesia এবং sphincter of dyskinesia. The sphincter of OD dyskinesia can be divided into two types. One is biliary type and another is pancreatic type. And there is difference between the symptoms between the biliary type and pancreatic type. The symptoms is gallbladder dyskinesia. Pain is at right hypochondrium and epigastric region. So there is associated pain in the right hypochondrium and epigastric region, and the episode is severe and often lasting for 2 to 3 hours until relieved by analgesic. So the pain persists for 2 to 3 hours and it's relieved by analgesic. It may radiate to back and under the tip of right scapula. So the pain may radiate to the back and the tip of right scapula, and the pain may follow fatty meal. It may associated with nausea and vomiting, and number 2, similar to chronic cholecystitis. So please can you repeat with me, and it will be very beneficial for you as well as to me if you repeat after me, and if your study will be done. So at first, where is the pain? Pain is the right hypochondrium and epigastric region, and episode there is episodes and it's severe and often lasts for how many hours? It often lasts for 2 to 3 hours until it relieved by painkiller or analgesics. It may radiate to the back and the tip of right scapula. Okay, and the pain may follow a fatty meal. There may be association with nausea, vomiting, and this is the pain criteria of the pain in the epigastric and right hypochondrial region. And there is number 2 point, similar to chronic cholecystitis. Okay, now sphincter of OD dyskinesia, biliary type. So here we have to know that they commonly occur in the female who underwent cholecystectomy for symptomatic cholesterol. Okay, so previously we have read about gallbladder dyskinesia. Now we are reading about sphincter of OD dyskinesia. But which type? This is biliary type. So here also the commonly occur in female who underwent cholecystectomy for symptomatic disease. Okay, biliary colic is pain in the epigastrium or right upper quadrant, often radiates to the back and may be associated with nausea and vomiting. It is generally occurs in episodes that last for up to several hours until relieved by analgesics. These episodes may occur at intervals of weeks or months. Some patients also describe discomfort in the upper abdomen, which often frequent and may occur every day. Features of recurrent cholangitis. So biliary colic, their epigastrium or right upper quadrant pain radiates to the back, associated with nausea, vomiting, and generally occurs last for up to several hours, and these episodes may occur at interval of weeks or months. So there may be interval of weeks of months. Okay, some patients describe the discomfort in the upper abdomen, which is more frequent and may occur every day. So there is increased frequency, even the pain may occur every day. And there is features of recurrent cholangitis. Recurrent cholangitis There is a feature of pain, fever, jaundice every day. So, sphincter of kinesia. Previously, we have talked about the gallbladder type or biliary type. Now, it is recurrent episodes of acute pancreatitis. Recurrent episodes of acute pancreatitis. Now, what are the investigations? Okay. So, at first HIDA scan, or here it is written about the 99 m technetium level immunodiacetic acid, gallbladder ejection fraction change to gallbladder activity or baseline gallbladder activity into 100. Normal gallbladder empties in 50% of its volume in response to standard meal or 45 minutes. Intravenous infusion of cholecystokinin octopeptide. In a patient with biliary type of pain, if the gallbladder ejection fraction is less than 40. So, what is the meaning of this line? The meaning of this line is normal gallbladder empties in more than 15% of its volume in response to standard meal or 45 minutes. Normal gallbladder empties more than 50% of its volume in response to a standard meal or 45 minutes. Intravenous infusion of cholecystokinin octopeptide. In a patient with biliary type of pain, তাহলে normal gallbladder empties more than 50% of its volume in response to a standard meal or a 45 minutes intravenous infusion of cholecystokinin. তাহলে gallbladder 50% এমটি কখন হবে? একটা স্ট্যান্ডার্ড মিলের পর অথবা অক্টোপেপটাইড যদি আইভিতে দেওয়া হয় তার 45 মিনিটের মধ্যে। কতখানি দেন? 20 milligram per kg per hour. If a patient is biliary of pain, if in a patient with biliary type of pain, if the gallbladder ejection fraction is less than 40, so it is diagnostic of the biliary dyskinesia. Sphincter of OD dyskinesia. Biliary type endoscopic sphincter of biliary type হলে sphincteric endoscopic sphincter of OD manometry করতে হবে। Okay. Now two table হলো sphincter of OD pressure and sphincter of OD dysfunction. So sphincter of OD pressure, there is basal pressure, Bangladesh Air Force or BAF, basal pressure, amplitude and frequency. Pressure is measured in millimeter of mercury, amplitude is millimeter of mercury, and frequency of n per minute. Okay, so normal range is 3 to 35. Basal pressure should be in the sphincter of OD is 3 to 35 millimeter mercury, and amplitude 95 to 195, and sphincter of OD pressure frequency or 2 to 6 per minute. Abnormal কখন? Abnormal হলো basal pressure তো 35 যদি 40 এর উপরে হয়, হ্যাঁ। তবে amplitude যদি more than 300 হয়, হ্যাঁ, amplitude যদি more than 300 হয়, dysfunction তাহলে amplitude বেশি হয়ে যাচ্ছে, ঠিক আছে। তারপর হলো frequency তো যাওয়ার কথা, না ফ্রিকোয়েন্সি 6টা, কিন্তু ওটা খোলার জন্য সিগন্যাল যাচ্ছে 7টারও বেশি। Sphincter of OD dysfunction. function, stenosis dyskinesia. Basal pressure more than 40, frequency 7, intermediate rise of basal pressure more than retrograde contraction more than 50%, paroxysmal cholecystokinin octopeptide response. Cholecystokinin octopeptide response is paradoxical. That means if we administer cholecystokinin octopeptide, the gallbladder should empty more than 50% within 45 minutes, but this not occur. So there is paradoxical cholecystokinin octopeptide response. So that's all for today.